What are the challenges you see with the standardized American diet or the Western diet at the moment, and how that really impacts our mental health and well-being?
So there's over 10 years of research now that is showing that there's an association, and also that we know pretty confidently that there's a causal effect between what you eat and your mental health. So those original studies started looking at whether or not people who ate a diet consistent with a Western diet, that is your high in your sugary drinks and your ultra processed products, your takeaways low in your fruits and vegetables, that people who are eating a diet that consistent with that have more mental health problems. And then conversely, that if you're eating a Mediterranean style diet, that seems to be protective, and that there's lower rates of mental illness in those people. But also prospectively, that what I eat today will predict how I feel 2 years, 5 years down the road. And so those studies also confirm that the Mediterranean diet is protective over time, and that the Western diet increases your chances of developing a mental health problem down the road. And then there's randomized control trials now that have shown that, and some of the randomized trials actually were done in the 1980s on kids with ADHD, where they took out the food colors and the food flavors and preservatives, and showed that kids that had an effect on reducing the symptoms associated with ADHD. And there were quite a number of studies over several decades confirming that was helpful for some kids with ADHD, although not all. But then more recently, there's been studies on depression, where if you change the diet towards a Mediterranean style diet from the standard American diet, that can help improve the depression of people who enter the studies with depression. So, and then those studies are being replicated. So we are pretty confident that if you pull that all together, you have a pretty robust picture that our diet does impact our mental health. And I don't think anybody could argue it otherwise these days, because it's replicated. And it's so consistent. The message is so consistent across the different studies and also across different countries. But that does, actually, something I did want to say is that it, you were indicating that the messaging out there is really confusing, and what should I do? Should I, eat paleo or keto or vegan or vegetarian or all of that? I think the best and easiest message to get out there is to reduce your intake of ultra processed products.
Yep.
Given that about over 50% of calories these days are coming from ultra processed products. Wow. And that's data from, I don't know if anyone's done that in New Zealand, but I know they've done that in Australia. They've done that in Canada. They've done that in the US, from the UK. So there's data from different countries that show that people are getting at least half their nutrients from ultra processed products. That in itself tells us that's where we start. We need to be shifting the population away from eating ultra processed products, because they're nutrient depleted. There's very low on those minerals and vitamins that we have found in our research to be so important. So that's, and that's something that I've only really sunk in over the last couple of years when I wrote The Better Brain, and was delving into, well, what are people eating on a population level, and going, really? Oh my God, I thought people were eating a healthy diet. That's what you keep getting told. Everyone's eating a healthy diet. And you're like, well, no, they're not. They're not. 69% of products sold in New Zealand supermarkets are ultra processed. So that gives you a sense of that's what people are eating. And so the easy message is just reduce your intake of ultra processed products, reduce your intake of those energy drinks, those soft drinks. They do nothing. They give you nothing. There's no nutrients in them. Avoid anything that's called, that says it's low in sugar, low in fat. That just identifies food that you really shouldn't be eating. Stick with what your grandmother would recognize as food. That's a good place to start. Real whole foods. And that's your nuts, your seeds, your legumes, your high in your fruits and vegetables, your proteins. A little bit of meat has been shown to be good for mental health. Fish is really important. Your omega-3 fatty acids, and getting them adequately from a fish source. It's very hard to get DHA and EPA from a vegetarian or vegan diet. And so you need to be mindful of that if you go down that route. So I personally would not be saying to people go plant-based entirely, because you risk getting nutritional deficiencies. It's very hard to get, as EPA and DHA from a vegetarian vegan diet. Very hard to get adequate amounts of iron, bioavailable iron. Hard to get B12, choline. I'm sure you know of others that you could mention too that are difficult to get out of that diet. And it's not to say, I'm not here to say don't be vegan or vegetarian. People who are vegan and vegetarian and are really healthy, fantastic. Great. That diet is working for you, but don't suggest that that's going to be the best diet for everybody.